Now I am going to explain about Guillain-Barré syndrome. Definition of Guillain-Barré syndrome. Guillain-Barré syndrome or Landry paralysis. It is a disorder in which the body immune system attack part of the peripheral nervous system. It is an acute progressive autoimmune inflammatory demyelination of the polyneuropathy of the peripheral sensory and motor nerve and nerve root. It means that Guillain-Barré syndrome, it is also known as a Landry paralysis. It only affected to the autoimmune disorder, and also they will be affected with the demyelination of a peripheral nerves, and also they will be affected to the motor nerves and nerve root. So this disease overall affected the persons, it suddenly paralysis, and also they will be affected with the immune power of the body. Incidence 1 to 2 cases per 1 lakh people annually, those are affected with the Guillain-Barré syndrome. Men are 1.5 of time more likely to affect than women. It is the most common cause of acute non-trauma related paralysis in the world. And third one is, the syndrome is named after the French physician Georges Gullian and Jean Alexander Barré and Stroll, who described in 1916. Next we see the causes of Guillain-Barré syndrome. It also known as the unknown causes. It is exactly the infections like infections with the bacteria and Campylobacter jejuni, or virus like the flu and cytomegalovirus, Epstein-Barr virus or Zika virus. Okay, these are the organisms they will be affecting to the myoneural junction and also nerve root. And surgery, who are already they are surgery with the persons like a labor or any spinal surgery, this also they will be affect to the GPS. In some cases a surgery can trigger to a GPS, and vaccination, that is a rare cases, certain vaccines may be increase the risk of Guillain-Barré syndrome. Classification. The first classification is acute inflammatory demyelinating polyneuropathy. It is the most common autoimmune response against the SMAN cells. And second one is Miller-Fisher syndrome, that is a rare variant manifest as a descending paralysis. Okay, I mean descending paralysis, they will lower parts they will be affecting to the nerves. It usually affect the eyes muscles first and presence with the trade of ophthalmoplegia, ataxia and then atriflexia. Okay, these are the organs they will be affecting or descending paralysis of the Miller-Fisher syndrome. And third one is acute motor axonal neuropathy, they will be affecting to the brain. It is also known as a Chinese paralytic syndrome, that will be attacked to the motor nodes of Ranvier and prevalence in the China and Mexico. Acute motor sensory axonal neuropathy, it is similar to a neuropathy. Acute pan autonomic is the most rare variant of Guillain-Barré syndrome, sometimes accompanied by encephalopathy. It is frequently occurring the symptoms including a impaired sweating because of unable to sweating in our body, lack of tear formation and photophobia, double vision, dryness of nasal and oral mucosa, itching and peeling of skin, nausea, dysphagia and constipation unrelieved by laxative or alternating with the diarrhea, affect the sensory with the several axonal damage. Okay, these are the problems they will be affecting to the acute pan autonomic of the Guillain-Barré syndrome. Next we will see about clinical manifestations. What are the symptoms they will be present after getting of Guillain-Barré syndrome. Acute pan autonomic signs and symptoms like a lethargic, fatigue, headache, decreased initiative are followed by autonomic symptoms including a orthostatic and lightheadedness, blurring of vision and abdominal pain. Progressive muscles weakness, because of already they will be affected with the myoneural junction and also the nerve root and numbness and paralysis of the patients with the GPS, and diminished reflex of lower extremities because of the patients are unable to walk properly. They will be affecting to the myoneural junction or nerve root. And prickly, tingling or sensation, numbness, they also present a low blood pressure because the blood pressure should be low, and paresthesia and tenderness and muscle pains also. These are the symptoms that will be present with the Guillain-Barré syndrome. Muscle spasm, palpitation, heart rate changes, there will be alternate changes of hypo or tachycardia and then bradycardia, sweating abnormalities, cardiac arrhythmias, neuromuscular respiratory failure, difficulty in eye movements because of photophobia, and problems will be happening of the optic nerve, facial movements or speaking, chewing or swallowing. These are the symptoms will be present with the GPS. In diagnostic evaluations, what are the investigations will be taken from the patients with the Guillain-Barré syndrome? First of all, they have to collect the detailed informations from the patients. Already if the patients are any family members who are all affected with the GPS and the presence and past history and family history, these are the history they will be collected from the patient. In physical examinations, there will be assessment of the sensory and then motor nerve. It only focus on the physical examination, and nerve conduction studies, CSF examination, electromyography, electrocardiogram. First we see the nerve conduction study. Nerve conduction study is a medical test that evaluates the functions of peripheral nerves by measuring the how quickly electrical signals that will be travels along them, helping to detect the nerve damage. CSF examinations. The CSF examinations, they will be collected from the patients. So they will be collect the sample and send to the lab, because what are the growing of organism, they will be enter into the cerebrospinal fluid. That's why they have to taken of a CSF examination. Electromyography is a diagnostic test that assesses the health of muscles and nerves that control them by measuring the electrical activity produced by the muscles. And electrocardiograms, they also taken. Already the symptoms will be discussed. If the patients having a arrhythmias, heart rate, tachycardia and bradycardia, that's why they have to finding that will be taken of a electrocardiogram. And managements, first management is plasmapheresis, high dose immunoglobulin therapy, mechanical ventilator, pain control and supportive care. These are the managements will be taken from the patient. First of all, they will be starting of a plasmapheresis. The plasmapheresis is also known as a plasma exchange from the patients. It is a procedure that remove the plasma from the patient. This process is used to treat the variety of conditions including a blood disorder, autoimmune disorder and nerve system disorder. These are the disorder they will be exchanging of a plasma from the patient. High dose immunoglobulin therapy is only starting of a intravenous immunoglobulin is a dose donated immune system antibodies. Your provider will infuse through a vein in your arm. You may need to, if your health condition or treatment weaken your immune system. Who are all persons? Those are affected with the immune system. There will be replacement of the intravenous immunoglobulin therapy that will be replaced. Mechanical ventilator, because the patients are unable to breathe properly, so they have to put the ventilator. They will be maintaining of the patient's respiration. And pain control, the patients having any pain, they will be starting of an analgesic medication and relaxation therapy, music therapy. They will be controlling of the pain. In supportive care and prognosis, start after 4th week from the onset. Approximately 80% of patients have a complete recovery of the Guillain-Barré syndrome. While recovery can take months or even years, most people regain independence walking ability within 6 months of diagnosis. Who are all persons? Those are affected with the Guillain-Barré Syndrome. They will be recovery. They will be taking of your time like a 6 month or 1 year. The patients after getting of GPS 6 month or 1 year, the patients will only walking. About 60% of adult fully recovering motor strength within a year of diagnosis. Some individuals may experience long-term weakness, numbness, fatigue or pain. In nursing management, that is our role. Treatment is non-specific and symptomatic. Observe the continuously for adequacy of respiratory effort because the patients will be bradycardia and tachycardia. That's why they have to continuously monitoring of the patient or observation of the patient, and continuously they will be taking of a ECG. I means the patients having already dysarrhythmias. And supportive nursing care measures indicates by the patient's degree of paralysis. And residual effect are rare, but prolonged facets paralysis leads to a muscle atrophy. It's requiring a rehabilitation and physiotherapy. In complication, breathing problems, weakness or paralysis in the muscles that control breathing can be fatal. Chest muscles involvements can lead to breathing difficulties. Heart issues, irregular heart rhythms and blood pressure and fluctuation are common. Cardiac arrest is a possible complication. Blood clots, people who are unable to move are at risk of developing blood clot. People who are unable to move are at risk of developing blood clot, and blood thinner and support stocking may be needed to improve the blood flow. Other complication, pain especially at the night time, difficulty in swallowing, speaking or chewing the food, bowel and bladder problems. In bowel and bladder problems, because the patients are unable to passing of a fecus and then urination. And pressure sores also they will be present because the prolonged bedridden of the patient, that time they will be pressures will be more and also presence of the pressure sore. In relapse which can cause muscle weakness year after symptoms end, pneumonia, skin damage, permanent paralysis of the patients with the GPS. Thank you.